Hi, I'm Elisa Willoughby at San Francisco Sport and Spine Physical Therapy, and this is Amy, and she's going to help me demonstrate good posture during pregnancy. Low back pain is commonly a complaint during pregnancy, and it doesn't have to be. So with some good posture tips, you can have no low back pain during your pregnancy. So we're going to start by looking at a common posture that pregnant women have. Or the bad posture. So here if you look at Amy, the first thing we're going to see is that her knees are extended or locked out. Moving up to the pelvis, her pelvis is tipped forward, and this puts a lot of load on the lower back. You can see she had an increased curve in her lower back here because her pelvis is tipped forward. And then moving up to her shoulders and her head. Her shoulders and head are a little bit back from the normal posture line that we want to see. So in this posture here, there's little muscle activity going on. So the back is not being stabilized, and a lot of excess load is going through the spine. So we want to do a few posture tips to correct this. So we're going to start down at the bottom. Her feet look good. You want your feet about hip width apart. Moving up to her knees here, she's going to just slightly unlock her knees so she's not in that locked out extended position. By unlocking the knees, you're actively going to use some of your muscles to support your body, and it's also going to help align her spine a little bit better with unlocked knees. Moving up to the pelvis, so we want to find a neutral pelvis position. So what I'm going to ask Amy to do is first tilt her pelvis back as far as she can, and then forward as far as she can. And then do that a couple more times until you settle into a neutral or middle ground. Then once she finds a neutral pelvis, she's going to actively stabilize herself there by engaging her pelvic floor and deep abdominal muscles. All right, and then once you have the knees and the pelvis aligned, the head and shoulders easily come into alignment with the shoulders slightly retracted, and the head is nicely floating right on top of her shoulders here. So in this posture, she is using active muscle strength to stabilize her body. Her spine is in an optimal position, and there isn't any excess load going through her spine. So if maintaining good posture does not help resolve any of your back pain, then it's a good idea for you to come in and make an appointment. We can have a thorough evaluation to figure out any specific things that are going on with your back and more specific treatments. And then the other thing is if engaging your pelvic floor and deep abdominal muscles is difficult for you, it's also good if you come in and make an appointment. We can do a few key exercises to help engage your pelvic floor and your abdominals. So I want to thank Amy for being my model today, and I hope these tips for posture help you have a more comfortable and healthy pregnancy. Thanks.